Good morning. I'm Professor Vico from Paris, and I'm the trialist, methodologist, and statistician for the CAM study. The principal investigator is Professor Frédéric Adnet. This is a study that has been sponsored by APHP, the hospital in Paris. The way to take in charge of patients with cardiac arrest out of the hospital is still controversial, especially regarding the way to properly take care of oxygenation of these patients, either by endotracheal intubation or bag mask ventilation. The benefits of endotracheal intubation in cardiopulmonary resuscitation is not clear at the moment, and some registries have recently suggested that bag mask ventilation could be better in terms of survival with good neurological outcomes than endotracheal intubation. It's the reason why we have done a randomized clinical study in order to compare the two techniques for patients with cardiac arrest outside of the hospital. Indeed, bag mask ventilation presents some advantages in terms of being less complex and easy to use, and with less, potentially at least, less interference with cardiac message and also technique of resuscitation. It's the reason why we have done a non-inferiority trial to compare the two techniques. Our primary outcome was the survival at 28 days with good neurological conditions. Secondary outcomes were survival and return of spontaneous circulation and different kind of adverse effects. Considering the results collected in different registries, we have calculated that the sample size of our study should be around 1,000 patients per group in order to have the sufficient power to demonstrate non-inferiority with a non-inferiority margin equal to 1%. We have included 2,040 patients and have observed very similar survival with good neurological outcomes in the two groups. 4.2 persons in one group in the bag mask ventilation group, and 4.3% in the endotracheal intubation group. Considering the confidence interval of this difference between the two groups, we did not demonstrate non-inferiority, but the study allows us to discuss the results of the registries. Indeed, the main result of our study was that in contrast with the results of registries, we observed very similar survival with good neurological outcomes in the two groups, with a survival rate with good neurological outcomes at 4.2% in the bag mask ventilation group and 4.3% in the endotracheal intubation group. In addition, we observed a better return to spontaneous circulations in the endotracheal intubation group than in the bag mask ventilation group. And the rate of technical failure was higher for bag mask ventilation than for endotracheal ventilation, respectively 6.3% versus 2.3%. aspiration or regurgitation of gastric content was also higher in the bag mask ventilation group than in the endotracheal intubation group. So, this randomized study did not confirm the positive results reported in registries regarding bag mask ventilation for patients out of hospital treated for cardiac arrest. And in addition, we observed more frequently treatment failure and adverse events in the bag mask ventilation group.